Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, granulomatous amoebic encephalitis. So, in granulomatous amoebic encephalitis, first, here this granulomatous amoebic encephalitis is a central nervous system disease. Okay, it is caused by mainly the certain species of acanthamoeba, and also Balamuthia mandrillaris. Certain species of acanthamoeba and Balamuthia mandrillaris are responsible for granulomatous amoebic encephalitis. A patient with granulomatous amoebic encephalitis will present with the following clinical features. The patients will present with focal paralysis. It can occur due to seizures or it can occur due to brainstem symptoms. And this granulomatous amoebic encephalitis is also caused by inflammatory necrosis of the brain tissue can occur. So actually the amoeba which is present, it enters the brain and causes amoebic infiltrates in the brain. This will result in inflammatory necrosis of brain tissue, thus resulting in focal paralysis, seizures, brainstem symptoms, and other neurological problems are also seen in this granulomatous amoebic encephalopathy or encephalitis. So here if you do a biopsy, and on the biopsy you will see that there is an infection is seen due to pathogenic amoebas. And here there is general inflammation is seen with sparse granules are seen in these in granulomatous amoebic encephalitis. And if you do a microscopic examination, you will see presence of infiltrates of amoebic cysts will be seen, or infiltrates of trophozoites will also be visible. Then treatment of amoebic encephalitis, granulomatous amoebic encephalitis, even with treatment, even with treatment also this condition is fatal. So because of it, it has a poor prognosis.
thank you and thank you for watching.